Doing this procedure can definitely prolong their time intervals when the tumor might recur, where they won't have to be on chemotherapy for the rest of their life. And there's some cases potentially you can cure patients, which before used to be uncurable. The whole surgical procedure is called cytoreductive surgery with hyperthermic intraperitoneal chemotherapy. For patients that have disease or cancer on the outside of their organs, you basically remove all that cancer, and that's the cytoreductive surgery part of it. And then the HIPEC part of it is at the same time in the operating room, you then put 2 catheters for fluid to go in and 2 catheters for fluid to go out, close the skin up. You add about 2.5 to 3 liters of fluid into the abdomen and heat that up to about 42 to 43 degrees Celsius. And we know cancer cells die at around 40 degrees Celsius and normal cells die around 44 degrees Celsius, so we get that in between. So you kind of hit it from both ends. Then once we hit those temperatures, we then add very high doses of chemotherapy. And the reason why we can use very high doses of chemotherapy, more so than you could give through your veins, is that very little of it gets absorbed. You don't get all the side effects you think of with chemotherapy. The surgery itself can take us 8, 10, 12, 14 hours. So the most common one where this has been studied the most with is appendiceal cancers, which is very rare. It can be very lethal. But with this treatment, there are patients that can actually live 10, 20, 30 years out. So appendiceal cancers is number one. Certain types of stomach cancers, ovarian cancers, peritoneal mesothelioma, really any disease that can cause the abdominal cavity to be seeded with cancer. A lot of times patients might not even have symptoms, and it's found incidentally either from getting a CAT scan or an ultrasound because they had some pain, they thought it was a gallbladder. Some patients present with a hernia. Some patients present with an obstruction, where they can't, unable to eat, they're throwing up, they can't figure out why that is. Or abdominal distension. People think they're gaining weight, but they look like they're either pregnant or they're big drinkers with a lot of fluid in their abdomen. So the symptoms are very, very variable. Bleeding and infection, those are the most common things we see with any operation. They can get a blood clot in their leg. The blood clot in the leg can go to their lung. They can get a pneumonia. They can get a fistula, which is a connection between the skin and the intestines. The most common one that we potentially will see is where patients aren't able to keep up with their calories. So we have to put a special IV in their arm, and at night they get nutrition in their veins. Okay, the risks are much higher than with a lot of other procedures. However, the benefits are much greater. We do know with this procedure that instead of just getting chemotherapy where the life expectancy might be 1 to 2 years, we can get patients out 3, 4, 5, 6, 7 years. And we have a lot of patients like that. So patients should be prepared really for the fatigue. As you can imagine, we're in the operating room a very long time. That's the easy part. The hard part is afterwards, patients recovering from this big operation. It's going to take a good 2 to 3 months to feel almost back to normal, where you can go back to work, doing your normal activities. They're going to be very fatigued and exhausted during that time period, but I tell them they have to get up, move around as much as you can, and every day do a little bit more. Our results, I feel, when you look at the data across the country as well as internationally, are excellent. Another reason why they come to Tufts, and a good question for patients to really ask, is what's the experience of the surgeon? So, I've probably done roughly 250 of these total in my career. We know what problems to potentially expect. We know how to take care of those problems, how to take care of the complications. And that's really where the experience comes into play.